All right, guys, come with you with our monthly social work talk. And I'm not going to keep you guys too long. So, we're going to talk about documentation, the importance of documenting. So, let's talk about documenting in a timely manner. As you guys are aware, in any profession that you are in, whether you are a nurse, a psychiatrist, a doctor, whoever, documenting in a timely manner is very, very important. So coming from a hospital, right, because I am a hospital social worker, the importance of when you see a patient, some people refer to them as clients, the importance of documenting your interaction immediately, the importance of documenting, I know we use Epic and we have like social work navigators where we go through sections to kind of check off, and then you have a body, where you would type up your wonderful paragraph. So we all know how to write a paragraph because, again, you don't want to tell a story. No one wants to read a book. So you want to get to the point. You want to say, we are a consult service. So the reason you are consulted, what the patient said regarding that problem, and what was your interventions? Did you make any referrals? Did you provide them with a list? What did you do? What was the plan? Okay, the plan, the next step, any follow-up, anything to that point. So you also want to make sure you identify any issues or barriers, like homeless, substance use, because those are the things that's going to keep some of our patients coming back. So that's definitely things that and if you collaborated with anybody, that's something else you also want to put down. Collaborated with, the interdisciplinary team, collaborated with DCF, Department of Children and Family, Elderly Protective Services, whoever you collaborated with. So just the importance of documenting in a timely manner. I work for the state, and I can tell you documenting had saved several people's jobs, whether there was a social worker and it was nurses. So if you're not documenting, as a nurse, meds, whatever in your progress note in a timely manner, people will look at that. We get audited. The state comes in, Joint Commission, JACO, you get DPH. So these things do happen. People are looking at your charts, people are reviewing your charts, and sometimes you see someone when you're documenting, 48, 72 hours later, come on. So I just wanted to really stress the importance of documenting, especially in the social work field. That is highly, highly important of doing that, and again, we're still just, check in. We are still in-house. We are meeting patients face to face as best as we can. We are practicing socially distance. We have our mask on. And again, in our hospital, most or majority are tested prior to coming to an inpatient unit. So that gives you, some relief, but at the same time, you just never know. So I do practice safe practices as always. I practice universal precaution, which I think we all should be doing that, or should have been doing that, but definitely should be doing that now, right? But I definitely, I didn't want to be all over the place. I'm trying to get back into the swings of our social work monthly talk. And again, if you guys have any questions or you think of anything you want me to talk about regarding the social work field, I can definitely do videos on that as well. So I'm open to whatever, but today I just felt, we did have a class today, and I want to say the importance of documenting, the importance of putting certain things in a note, not putting certain things, using proper verbiage. You all, if you are a social worker, you went to school, so we all know certain lingos to use, explore, clarify, problem solving, motivational, certain things that you want to use to sound like you are a professional, that you did go to all the school and have this wonderful fancy degree, right? So you definitely want to include that in your notes, and just always remember about limitation. Always remember things that's just not relevant, because again, you could talk to a client, patient, they can go on and tell you their whole story, their whole life. Others won't tell you much, and it'll be like pulling teeth to get something, and others can just go on from when they were born to where they're at right now. So some of that stuff you can exclude from your note, exclude from your documentation. Always remember the now. Okay, we meet patients where they are now. What happened when you were 16 is relevant. Yes, I need to know that. But now that we are 45 and 50 years old, let's talk about the now, right? So just always keep that in mind. Again, when it comes to documentation, everybody does documentations different. So, you know, depending on the hospital, depending where you work, and depending on what type of practice, what type of social worker, because there's so many different social workers. It's such a very open, broad field, because there is medical social workers, psychiatry, you know, case managers, just so many different types, and we all document slightly different, believe it or not. You know, there are some notes that's like this long because of depending on the department and the type of social worker and the type of work, where there are others that's like this short because, again, depending on the type of social worker. I swear there is like a social worker for everything. There really is. Like, it's nice and amazing. So that way, if you are thinking about social work, you can do so much. School social work, hospital social work. And in the hospital, it's not just like, I am a medical social worker, but then I also do trauma, because I also do an on-call piece. So there is, if you want to work in the psych department, if you want to work with geriatric social worker, if you want to work with the palliative care, I mean, there's just so many types of social work. If you want to do outpatient, if you want to do community, meaning like the oh my god, I'm having a moment, like the clinics. So if you want to do community social work, if you want to do the clinics, if you want to do IOP, substance abuse, if you want to work with methadone, if you want to do inpatient versus outpatient, there is just so many different fields. If you want to do in-home versus not in the home, you know, so it's a very rewarding career, and it's a very rewarding field. There's just so many different types of social work you can do. And again, the documentation for every type is different. It's slightly different. You know, there are criterias that, depending where you're at and depending on your agency, your facility, or your job, you have to do or you have to meet, right? But so always keep in mind documenting in a timely manner, paragraph format. Don't want to say too much, don't want to say too little, but keep to a very short story. You know, very, very short story, without rambling on, without going into too much details. Just keep it simple, straight, clean, a good paragraph. You know, I definitely try to say, okay, once I start hitting that 7 to 9 lines, I'm like, okay, do I need to add this? Or let me reread this to see if there's any way I could maybe collapse a sentence into one without sounding repetitive, right? So definitely, you know, just wanted to talk about documentation, the importance. I was trying to pick what should we focus on in the month of September, and I thought it was perfect since I went to this class this morning, and I said documentation was perfect because it's kind of what we talked about. Documenting in a timely manner, not waiting to document, you know, because sometimes we get so busy, we're seeing multiple clients. You don't want to confuse the information and put the information in the wrong chart, right? We never want to do that. So, because there are other providers that are reading that chart. So if you document on the wrong patient because you were so busy, you know, seeing several patients, and now you can't remember who was who, that happens. And then another thing with documenting, I like to, you know, I always bring, you know, I bring a face sheet. Some people prefer a notepad. I jot things down, abbreviate things. I'm not writing full sentences because, again, I want to pay attention. I want to actively listen to what you're telling me and what you're not telling me. I like to see if there is direct eye contact. And I like to watch, you know, your verbal and nonverbal cues. So if I'm so busy, what is your name? Where do you live? How old are you? Are you married? Okay, you've been using drugs. How long? How am I going to pay attention to you? So we definitely don't want to do that. Definitely not. You know, we want to come in and present that we know what we're doing even if we don't, right? You want to come in, and you want to come in confident, because they can sense that. They can sense if you're not confident in your job, because then that patient's not either they're not going to open up to you, or they're going to look at you like, okay, how are you my social worker? Or you look like you need a social worker. We never want to present that way. So you want to come in confident. Even if you don't know the resource, even if you don't know what's available, sure. You know what? After you finish your conversation with that person, you can say, well, let me look into that for you and I will get right back to you. I'll definitely follow up with you. Okay. And then you can go find out, ask, research, Google, whatever, and then come back. So just the importance of documenting in a timely manner, making sure you're capturing the details that is relevant to the consult, to the reason why you're there in the first place. That's the most important thing. Why am I here? Oh, I'm consult because you're homeless. Oh, I'm consult because of substance use. I'm consult because of mental health. So focusing on the reason that you are here will help you direct your questions, so that way, and sometimes patients go off topic. Redirect, okay, and then you bring them back and continue. So I really just wanted to talk about documentation. That was pretty much what I had for our social work monthly talk, But again, if you guys have any questions, leave a comment. If you want me to talk about a specific topic regarding social work, anything you want to know regarding social work, just leave the question, leave your comment. I will definitely reply. I do try to reply in a timely manner. So again, I am open to discuss anything regarding social work, whether school, education, licensure, job, salary ranges. Whatever it is, if you guys have a question, definitely reach out. And again, I just wanted to check in, see how everyone is doing. That's what social workers do. We check in with our friends. And again, everything's still the same. We're face-to-face. We are meeting patients. We are doing consults, and we are all hoping for the best, right? Fall just got started, so we'll see what the fall and what happens when it starts to switch over to winter. So we will see what that looks like for us. So I'll definitely think of another topic for October. September was definitely documentation. If you have any more questions regarding documentation as well, definitely leave it down below. And October, I'll try to think of a topic. I'll try to see what I know every month there's something going on, this awareness or whatever. So maybe I'll try to find something, we'll see. I know right now everyone is dealing with their children, with schools, which is a big anxiety for families, because some people are hybrid, some people are face-to-face. My child is face-to-face Monday through Friday. Others are hybrid. Others are hybrid distance learning. Others are straight distance learning, and other schools, I don't even know if they figure out what they're doing. But anyway, so there is so much going on. People trying to figure out childcare. So there's a lot of angst regarding schools right now, but everyone is doing the best that they can. And I'm sure social workers at schools, they're definitely providing support for the staff, support for the students, support for the parents. So I know right now, I'm sure they are heavily utilized, because I know in the hospital, we are also heavily utilized. So I can imagine schools right now, with everything going on with education right now. But anyway, guys, thanks for watching, and I will see you in our next social work monthly talk. Bye now.